Heal your headache. The essential guide to treating headaches the natural way. Discover the different ways and effective methods you can try to heal your headaches naturally. Chapter 1: The IHS System of Classifying Headaches.
The earliest classification system, which resembles those that are used nowadays, was formulated in England by Thomas Willis in 1672.
Nowadays, the mantle of classifying headaches has been taken over by the International Headache Society, who published the first edition of the International Classification of Headache Disorders, or ICHD, in 1988, with the revised second edition appearing in 2004.
As this system of classifying headaches is accepted by the World Health Organization, it is also one that is most commonly used by medical professionals all over the world as well. The ICHD contains explicit diagnostic criteria that can be applied to various different types of headaches and uses a numerical code to classify the various different types of attack.
Tension-type headaches. What are they and what are the symptoms?
Tension headaches, or tension-type headaches as they were renamed in the first edition of the ICHD in 1998, are by far the most common form of headache, with some estimates suggesting that as high as 90% of all headaches suffered by people anywhere in the world fall into this category. Tension-type headaches are further broken down into two subcategories, episodic and chronic. The first of these would be defined as tension-type headaches that occur on less than 15 days in every month, whereas any headaches that occur more regularly than this over a period of at least 6 months would fall into the chronic category. With a tension-type headache, the pain can radiate from the eyes, neck, back, or indeed from any other muscles in the upper body. The pain is often described as being one of constant pressure, something that feels as if your head is trapped in a vice or between two bricks, and it is relatively common for the pain to be felt on both sides of the head at the same time as well. What are they, and what are the symptoms? Tension headaches, or tension-type headaches, as they were renamed in the first edition of the ICHD in 1998, are by far the most common form of headache, with some estimates suggesting that as high as 90% of all headaches suffered by people anywhere in the world fall into this category.
Tension-type headaches are further broken down into two subcategories, episodic and chronic. The first of these would be defined as tension-type headaches that occur on less than 15 days in every month, whereas any headaches that occur more regularly than this over a period of at least 6 months would fall into the chronic category.
With a tension-type headache, the pain can radiate from the eyes, neck, back, or indeed from any other muscles in the upper body. The pain is often described as being one of constant pressure, something that feels as if your head is trapped in a vice or between two bricks, and it is relatively common for the pain to be felt on both sides of the head at the same time as well. This is known as suffering from bilateral pain.
Most commonly, a tension-type headache is likely to range from relatively mild to moderately painful, but sometimes the pain can become severe or even extremely severe.
What causes tension-type headaches? Until relatively recently, it has long been believed that tension-type headaches were generally caused by tension in the muscles around the neck area and in the head. For instance, it had long been suggested that a primary cause of tension-type headaches was excessive clenching of the teeth, which causes a serious contraction of the temporal muscle.
However, more recent research has suggested that many tension-type headache patients do not have excessive tension in their muscles at all. So this theory now carries less weight than it did previously. Another theory that seems to have more credibility is the idea that tension-type headaches may have something to do with a temporary malfunction in the area of the brain which is responsible for sensing and controlling pain.
The theory has it that due to some kind of malfunction involving neurotransmitters like serotonin, the brain misinterprets ordinary signals from the muscles as being pain, hence the presence of the headache. What is not disputed is that there are many different causes that can bring on headaches of this type.
Amongst these causes are the following: stress, lack of sleep, eye strain, caffeine withdrawal, improper or bad posture, irregular meals, or eating food that triggers the headache. However, you should note that these are just the widely accepted and well-known causes that often bring on tension-type headaches, and that what actually triggers an attack in any individual can be as personal as the severity of the attack itself.
In effect, every individual who suffers tension-type headaches will do so for their own different reasons. It is therefore imperative that if you are either an episodic or chronic tension-type headache sufferer, you need to isolate exactly what it is that is causing your problem before attempting to deal with it.
For instance, many women will suffer tension-type headaches just prior to the onset of the menstrual cycle, often associated with premenstrual syndrome. In other examples, loud noises or bright flashing lights can trigger headaches in some people, so there really is no way of listing every possible cause of tension-type headaches because every individual is different.
Migraines. Migraine headaches are fortunately suffered by a relatively small percentage of people, but for those who do suffer, migraines can literally take over their life.
Migraines are categorized by the International Headache Society by degrees of severity, with a Category 0 attack being extremely mild, so that life goes on relatively normally, ranging to 3, which represents severe pain that prevents all forms of activity.
Migraine headaches are a neurological syndrome where the pain in your head can be accompanied by altered perceptions, nausea, and/or vomiting. The typical migraine attack is unilateral, affecting just one side of the head, with a pulsing, throbbing pain, which can last from 4 hours up to 72 hours.
The pain is often accompanied by an aversion to light or noise, and it is believed that up to 1/3 of people who suffer migraine headaches will recognize the onset of an attack because of altered visual, oral, or olfactory perceptions immediately beforehand.
The widely accepted cause of migraines is that they come out as a result of some kind of imbalance in the serotonergic control system, as scans have indicated that many migraine sufferers show significantly increased levels of blood flow to the brain just prior to the onset of an attack.
However, not all migraines seem to come on in exactly the same way, with some people being genetically disposed to suffering migraines. On the opposite side, there are those with no genetic propensity to migraine attacks who suffer because of malfunctions in the transport of potassium and calcium ions in the brain.
There also seems to be some connection with fluctuating hormone levels, indicated by the fact that in adults, 75% of people who suffer migraine headaches are women, whereas migraines affect similar numbers of prepubescent girls and boys. Furthermore, whilst some women suffer more migraine headaches during pregnancy, others find that their susceptibility to migraines disappears completely whilst they are pregnant.
As suggested, up to 1/3 of migraine sufferers will find that their attack is preceded by a period where they sense, see, or hear an aura that will gradually come on over a period of 15 minutes or so and last for less than 1 hour. Generally speaking, after the aura has disappeared, the migraine attack itself will begin within an hour of the disappearance, although it can be several hours before the attack happens.
For the majority of migraine sufferers who do not sense or see an aura, they will often experience other symptoms such as heightened irritability, yawning, fatigue, euphoria, or feeling blue, as well as suffering stiff muscles, especially in the neck. Most sufferers have characteristic signs that almost always indicate the impending onset of a migraine attack, which can follow anywhere from a few hours to a few days later.
Because these signs gradually become recognizable and clear over a period of time, a reasonably observant migraine sufferer or family member of a sufferer can predict with a degree of accuracy when they are about to have a migraine attack, meaning that they can try to do something about preventing the attack happening.
Whether such preventative action is going to be successful will depend on many factors, but knowing when an attack is likely to happen does at least allow the sufferer to try to head it off.
Cluster headaches. Cluster headaches, so called because sufferers tend to have several headaches one after another in clusters separated by periods of remission, are headaches of intense pain that can last from 15 minutes to up to 3 hours at a time.
Cluster headaches are most commonly unilateral, although some sufferers report having shifting headaches that move from one part of the head to another with the onset of the next attack in the cluster, and the onset of the first attack is often very sudden and without warning.
They are far more commonly suffered by men than women, and for the majority of sufferers, there is no warning that an attack is about to happen. However, some people do report a slight shadow pain in the area where the attack is about to happen shortly beforehand.
What causes cluster headaches is currently unknown, and due to the intensity of the pain, Many sufferers mistake the first attack for something considerably more serious, like the beginning of a brain tumor or multiple sclerosis, until they seek treatment.
Sufferers of cluster headaches generally report that the pain associated with the condition is the worst pain that they have ever known, with many women sufferers reporting that the pain is considerably worse than giving birth without anesthetic.
Generally speaking, the pain is felt behind the eyes or in the temple, although it can stretch out into the muscles of the neck, with many sufferers describing the feeling as being akin to having a red-hot poker stuck in their eye.
And considering that some sufferers will have cluster headache attacks 3 or 4 times a day for weeks on end, it is hard to imagine how painful and debilitating the condition could be.
When the condition was first recognized and postulated by Dr. B.T. Horton in 1939, he suggested that suffering cluster headaches could drive any man to suicide, which is one of the reasons why they are also known as suicide headaches as well.
Fortunately for the majority, it is believed that as few as 0.1% of the population are forced to suffer cluster headaches, but for those who do, the pain is far worse than anything the rest of us, even the most severe migraine sufferers, are forced to endure.
Trigeminal neuralgia is a similar condition to cluster headaches, another form of headache where the pain is intense, but in this particular example, it is more common for the pain to be felt around the cheek area rather than behind the eyes or in the temple.